Dr. Kulkarni, a very good morning. This is Binay. Thank you so much, sir, for joining in.
Good morning to all of you, and thank you so much to all the participants who have joined us. So it starts at 12 o'clock. We're just waiting for Dr. Sanjay and team. And once again, thank you so much to all of you.
Morning, Mangesh. Just to check the audio video. Is it okay?
Yes, sir. It's neat and clear.
Thank you.
Perfect. Thank you, sir.
Hello, sir. Okay, so Mangesh, am I audible as well? And
yes,
clear?
Neat and clear. Perfect.
Okay.
Once again, I welcome all the participants. We are just waiting for Dr. Sanjay and team. And very good afternoon to all of you on this very special occasion of World Stroke Day. I welcome Rakesh and team also, who have joined from all the way long from Uganda. Thank you so much, Rakesh, for joining this.
Thank you. Thank you, Mangesh. Thank you. Good
Thank you.
afternoon.
Morning.
Good morning, sir.
Morning. Vinay, how are you? You okay?
Okay, I can see. Hi, all. Very good morning. Thank you all for joining in. I can see people well from London, UK, and other countries also joining in, right? So give us a couple of more minutes and we'll start the session soon. We're expecting Dr. Sanjay as well to join in. So please bear with us for additional couple of minutes, right? And we'll soon start.
Dr. Sanjay will be joining us in the next couple of minutes. Thank you for having the patience. Good afternoon to all of you. As we all know that today is 29th October and it's been observed as the World Stroke Day worldwide. And as we all know, the data are quite alarming. Out of 4 people, 1 of us are suffering from brain stroke. And that's where the entire concept of Aapki Lathi starts ahead. On this very day, we have organized a webinar on this particular session. I introduce our guest speakers, Dr. Sanjay Kumar, a very renowned and a very eminent senior consultant neurosurgeon. He is the vice chairman of Medica Super Speciality Hospital, as well as he is the director of Institute of Neurosciences of Medica Hospital, Ranchi, Jharkhand. I introduce you Dr. Nitin Madan Kulkarni, one of the fireborn IAS officers Jharkhand have ever seen. He is the divisional commissioner of Chota Nagpur, Ranchi division. He takes care of 5 districts, as well as he is the vice chancellor of Dr. Syama Prasad Mukherjee University. Dr. Nitin have holded a lot of eminent portfolio in the Jharkhand government, as well as let me introduce you to Binay ji also. The entire concept of Aapki Lathi starts from Binay, and somewhere it's related to stroke. We will listen to his story also, how it all started. In the meantime, I invite Dr. Nitin Madan Kulkarni, and after that, the session will be followed by a PPT presented by Dr. Sanjay Kumar. And then we will go ahead with our co-founder and CEO, Binay. Binay have holded a very important portfolio. He was the VP for Business Development of Telecom for Accenture. So I invite Dr. Nitin Madan Kulkarni. Sir, please.
Good afternoon. Thank you, Mangesh, for that introduction. Dr. Sanjay, Vinay, and all the respected dignitaries who have joined today's webinar. I wish you all a very warm good afternoon. Today we cannot say celebrating, but we are observing World Stroke Day. And in health sector, you always find that there are a number of days like Diabetes Day, Heart Day, and days keep on occurring. But these days are just to act as a strong reminder for us, because in our very fast way of living, we have almost forgotten that we also exist as a human body, which needs to look after. And if you don't look after your own human body as rightly.
Sorry for the interruption, sir. Sir, your voice is a little bit low. So if you could just, yes, sir, please. Sorry, sir.
I hope, is it audible now?
Yes, sir, it's audible.
Great. So I was trying to say that we always tend to neglect what our scriptures describe as a beautiful temple of our own human body. And that results in such type of catastrophes. And obviously the name stroke itself spells a sort of a threaten and creates a great fear amongst the people. It's no wonder that almost about 13 million people are getting affected by stroke worldwide every year. And as Mangesh rightly mentioned, almost it's a risk for about 25 years it's almost 1 in 4 getting affected by the stroke. Now, the impact of the stroke obviously varies. In some cases, it's very mild, but in some cases, it ends up obviously in the death. Depends on the part of brain which is getting affected and the extent of the damage. It also depends on what type of stroke we are actually looking at. There may be a ischemic or a hemorrhagic one. And unfortunate part is that almost 2/3 of these stroke cases are occurring in the lower income countries and the lower or middle social strata of the society. The risk factors are also clearly defined. Almost all of us know them: atherosclerosis, tobacco, alcohol, high blood pressures, obesity, obviously, and lack of physical activity. And for last 1.5 to 2 years, because of these COVID lockdowns, we find that most of the people who are staying or working from home have reduced their physical activities and have ended up gaining some extra weight, even that is very prominently seen in children who are not attending the schools. Another pitfall has been that this COVID infection has further increased the risk of the stroke, particularly among the youngsters. And we find that number of stroke cases occurring post-COVID are also increasing, and the age group is going down. Unfortunately or fortunately, 90% of these events are totally preventable just by altering the lifestyle. But as the theme for this World Stroke Day 2021 goes, minutes can save lives. The only way is to first identify that it is a stroke. Many times the symptoms are so subtle or so minute that we tend to miss them as a stroke, and it is being taken as something different and treated as something different. So if we can recognize it early and treat it quickly, we can definitely help that case. And as that acronym goes, which says FAST, like fascia dropping, then arm weakness, speech difficulties, and the last T is for time to call ambulance, which we always tend to forget. Another major problem with the stroke is that while treatment part obviously remains, and Dr. Sanjay will deal the technical aspects of how the thrombolytics can be used or how the surgery can be used. Question is about the rehab of the patient, and that is the most critical part of any stroke case. And this is the one which takes a lot of time, energy, and resources, not only of the patient, of the healthcare system, but also of the family from which the patient comes. Continuously having rehabilitation mechanisms is difficult to sustain for.
Sorry for the interruption, sir. You're not audible.
Hello?
Yes, sir. Neat and clear now. Ready to go.
Chances of recurrence in these cases further complicates the issues, and this rehabilitation of these stroke patients in various forms of impairments or paralysis is creating lots of rehabilitation cost in economic terms, in social terms, and also a great sort of a mental cost on the families who have to look after these patients. So we need to have a very clear awareness campaign so that we can always see to it that stroke cases get identified at the earliest possible sign. It is said that if we can identify it quickly and the treatment starts within 3 to 4 hours max, we can recover most of the stroke cases to a large extent, not 100%, but to a large extent. So our healthcare workers, particularly community healthcare workers, need to be very aware of this fact that there is something called a stroke and how early signs are to be detected. And also all the people who have some knowledge of health or who are generally educated, like we always say that people must understand how to do CPR. Similarly, we must make efforts to make our population, our college students, our high school students aware of the signs of the stroke so that they can immediately identify such cases which are occurring in their family or in their nearby vicinity and immediately take some corrective steps. because the only way you can manage or treat the stroke is to hospitalize and treat the person, not trying to do something at home. It is not going to help, at least in this particular case. So I only expect that the technology, the new technologies will also help us how to further enhance the diagnostic capacities of us, and also further the treatments will also improve. But in the meantime, the goal is to reduce the stroke events or stroke deaths by 50% till 2030. So if we have to go up to this goal, we will have to immediately start working, and all strata of the society will have to come forward and contribute to how to be an active participant in this prevention. Because as I already said, 90% of these cases can simply be prevented by just altering the lifestyles and reducing the risk factors, which are very obvious in most of the cases. So I wish that the awareness which Aapki Lathi has tried to generate, this new startup is basically working for the elderly population, and for them this is the most relevant issue because they are the ones who are most vulnerable and susceptible for this. So I expect that you will use your platform also to further encourage and make people aware about this stroke, and that will help us to reduce the morbidity and mortality associated with stroke. I think with that I should stop here. We like to listen to Dr. Sanjay for his expert comments, who is very reputed neurosurgeon for this particular area. And so thank you very much. I wish you all the best. Thank you very much.
Thank you so much, Nitin sir, for all your time from your esteemed busy life. Without wasting any further time, I just invite Dr. Sanjay just to go ahead, and the entire dais and podium is all yours. Please, sir, you're most welcome. And Sumant will be helping you technically on the aspect of PowerPoint presentation. So I invite Dr. Sanjay and team. Please, sir.
Hello, good afternoon. Am I audible?
Yes, sir, neat and clear, ready to go.
Yeah. First of all, I'd like to thank Dr. Nitin Madan Kulkarni for setting the ball rolling, and he, with the huge experience that he has, and more so for heading Jharkhand as health secretary, and he has seen things from a very close corner, being a doctor himself and then being a health administrator, and especially in this part of the country. He has rightly mentioned that this burden of stroke is seen higher, and the cost not in terms of monetary cost, but the cost is tremendous. I would rather call it bad cost, especially in the underdeveloped parts of the country or the world. So he has the insights as to what are the measures that can be taken to, combat this menace of stroke, I would call. And we all are dealing with the word pandemic, and we are living with pandemic. But it wouldn't be surprised if we label this something like a mixture of epidemic or pandemic or whatever you would like to call it. But stroke is going to be our biggest problem in not distant future, but just near coming future, and especially so for India. And Dr. Nitin Madan Kulkarni has rightly mentioned he has just given an insight as to what should be the awareness level in terms of the knowledge about the symptoms and signs in an individual, in a family, or in a society. Unless you start picking a problem at home, unless you start demanding facilities, none of the things are going to come up in any part of the world. And the resources, the utilization and distribution, as any government does it, it's again because of the burden that the society faces. And stroke is a huge burden that the society is facing. And especially I have seen, in Ranchi, It's being a capital, it has got a catchment area from surrounding 5-7 states. The burden of stroke is very high, and if the patients reach you in time, you can do something which can make the outcome of the patient very significant and very productive. But they reach very late, and the reasons of reaching late are manifold. One, as Dr. Nitin was mentioning, that you do not know that it's a stroke and you treat as something else. Moment the first doctor, the first doctor, if he writes something on his prescription, all the subsequent doctor tend to agree with the first doctor, is the first thing I would like to mention here. And so if this patient is put on a road which leads to a different kind of diagnosis or treatment, then the patient has had it, number one. Number two, the patient thinks of going to a hospital, but he has to go to a proper place. So I'll be discussing all these things. I'll just go back and couple of slides because I know I can't be too technical, but I think we should raise our threshold and the bar high, that we can understand a few words. And I believe in the word medical empowerment of a common man. And a common man should be knowing more than what is required today. The true knowledge, not the ill-cooked knowledge we get at times from different kind of places. So this slide tells you that stroke is sometimes called a brain attack. This word brain attack was introduced in the nomenclature, in these jargons, medical jargons, because heart attack everybody knows. And moment you say heart attack, people are, oh, jaldi karo, something has to be done, right? And they rush to a doctor. So just to take cue from this heart attack, the word brain attack was introduced worldwide, because moment you hear a word attack, everybody's alert. So this word attack means the doctor and the patient, the family and everybody should give importance to this word. Sometimes you call stroke, sometimes you call brain attack, sometimes people call CVA, cerebrovascular accident. Again, accident is a word which is almost like, something wrong has happened, you have to act, right? So in a heart also, the brain, the heart cells keep on dying, brain also, the brain cells keep on dying. So you have to act fast, be it heart or be it brain. And the word stroke is there common for both. So immediate action has to be taken. And it's basically, this attack is a culmination of the cerebrovascular disease that is prevalent in the population, in the person, because of all those kinds of Dr. Kulkarni was mentioning. You have to go for lifestyle modification. And I would rather be concluding in my last slide with this only. So this cerebrovascular disease takes place because of a lot of factors. We'll see the next slide. Yeah, this day, Dr. Kulkarni has rightly mentioned, there has to be an awareness about the why we're talking, why you need a day. Many days are being observed just to bring into focus that particular disease, the caregivers, health caregivers, the patients, and to understand why we need to and how we need to join hands together to make things better for that particular disease. Stroke is a thing which is of very serious nature, and this awareness has to go. Sometimes they say just chakkar aa gaya, just jhinjhini ho gayi. It may be a harbinger of stroke. Maybe these are the first symptoms. You did not have a full-blown stroke. You had a transient ischemic attack. These are the words which a doctor would use, and a doctor would be using these words just to make you understand that this is a mini stroke, right? And the rates of stroke is very high. So the person having or the family having stroke may be the first, but the burden on the society is very high. And then we need to talk on this day about the ways in which we can reduce the burden of stroke through better public awareness and awareness about the risk factors and the signs, and then raising the bar. Dr. Kulkarni was saying about rehabilitation, most important, very important. And I was mentioning stroke has reached epidemic proportions. Dr. Kulkarni was mentioning 1 in 4 person would be suffering from stroke in this lifetime in the age group more than 25 years. Can you imagine the risk? 4 of us sitting in a room, one can have a stroke sometime. And the word stroke should, and rather it does, bring out an element of fear. So if you're going to be fearful for something, be fearful now, and then try to take all measures to understand and prevent it in future. We all only can decrease the level of fear. Fear of unknown is the most dangerous fear. Let us have the fear of known. And this is the third, Dr. Kulkarni was mentioning last slide, 2 out of every 3 persons in a low socio-economic group, right? When they belong to the low socio-economic group. So why low socio-economic group is vulnerable? Because again, same lack of education, lack of facilities, be it government, be it private, and even the, thanks to the NGOs who have started focusing upon these areas. But I hope the society understands the pain that the NGOs are taking in, foraying into those interiors and bringing into focus the importance of health. They can only do a limited work, this part or that part of work. But we need to, this has to be a buzzword, right? All have to keep on discussing about diabetes and blood pressure and stroke and all those kinds of things, right? Next slide, please. And this shows that this is the third most common cause of death, even in developed countries, right? Because underdeveloped and developing countries, you do not rely upon the data, and developed countries' data, but it speaks something different about the realities of a developing country. Next, look at India. India, the data says 90 to 222 per 1 lakh population, right? Now you just calculate how many lakh population is there in your city, and then what would be the number of patients getting affected from stroke in a year. It's almost like 1.5 million cases of new strokes per year. And then what is more disturbing for all of us is that 12% of these strokes occur in the population aged less than 40 years. How does that come to 12%? How much? Every 8th person less than 40 years. And we have a maximum population in this group, right? 25 to 40. India has the middle age group population in the maximum, the most productive group. And if our most productive young population is 1 out of 8 person is going to suffer from stroke, is it not dangerous? What are we waiting for? I think it's more dangerous. COVID and all these things, they hammered us in one go. And that's why we all were panicky and we were in deep trouble. This is something which is a sweet poison, slow killer, right? And now look at a person who has suffered stroke in the age group 18 to 41 years, young group I was mentioning, and the fatality rate in, what is that? If a patient suffering from stroke and next 30 days, in these 30 days, at least 30 to 40% people will die. Forget about those patients who survive and have got a poor quality of life. So we have the most common identifiable reason that everybody would be talking is about the unhealthy lifestyle. And because of increasing health facilities, the life expectancy is also increasing. And stroke is more common again in the elderly group. So your life expectancy is increasing. So this elderly population is again vulnerable for stroke, right? So you have to start preparing now only. Next. Yeah. Now look at the perceptions about stroke. The myth is that stroke is not preventable, and here we all are sitting here saying yes, it is preventable. 80% strokes are preventable. This is the reality. Then people say stroke ho gaya to it ho gaya to ho gaya. No, it requires an emergency treatment. It requires a teamwork. It requires all kind of treatment up to the rehab state. And once a stroke, you are always a patient. You may not be an acute patient, but you are a chronic patient. And the aim should always be not to survive the life, but the life should be more, as much as possible, socially, usefully productive. Rather, in other words, I would say it should have a better quality of life. And then people say stroke only strikes elderly. I just gave you the data and the bare facts that it can happen in young age. And then I did mention about why people talk about heart only. No, sir, it's brain attack now. And then, as I mentioned, it's a lifetime treatment. Stroke recovery doesn't end after 6 months. The most common thing as a neuroscientist, we keep on getting chemana ho gaya, nothing can happen now. No, there's brain reparative procedure, whatever it is called, recuperation or neuro regeneration or neuroplasticity, so many scientific words. But whole life there is some changes going on. Next slide. Yeah. Now everybody knows this information is available everywhere, but we need to bring into focus, and hence this slide today, that 85% strokes are because something has blocked a blood vessel, and then the further blood supply is not going to an area of the brain which dies. As simple as that those cells die. We say that if the most important thing for brain is oxygen and blood glucose. Blood glucose is the food, and oxygen is very important for survival. So a person having any problem in oxygen reaching out to the brain, any reason, trauma or any reason, and similarly blood sugar very low, patient becomes unconscious because the brain doesn't get the required amount of food, right? That is what we call hypoglycemia. So any particle, and most commonly this particle is a small blood clot, which normally comes from the heart. Either the patient has got some rhythm problem in the heart or some coagulation disorders. So this gets blocked. And that particular area, so you can see one of the slide left side, when there's ischemic stroke, that area is become less, it's darker than the normal brain color. So this is 85% ischemic. We call it ischemic stroke. We call it infarct. The blood supply is less, means there is ischemic. The rest 15% is hemorrhagic, means brain hemorrhage. But we all know brain hemorrhage more, because this onset of symptoms of brain hemorrhage is very severe. And small one, this artery getting blocked, this is slow, right? But look at this, a slow onset problem, the society takes it slowly, and 85% population belongs to this category. Hence, the stroke treatment getting so complicated. And this 15% people, hemorrhagic or brain hemorrhage, the sequence of events are so very fast that people rush to a hospital, and a CT scan shows some hemorrhage and the doctor gets alerted. On the contrary, in that ischemic one, even if you reach a hospital and the CT scan is showing normal, as Dr. Kulkarni was mentioning, a wrong treatment started. People say your stroke, your CT scan is normal, nothing needs to be done. The fact is, if you have a typical symptoms of stroke and a CT scan normal, if you reach a place, a hospital where there is facility of thrombolysis, I'll be talking about in the next couple of slides, a drug dissolves the clot, which is obstructing the blood vessel, and blood flow restarts to that area of the brain, and patients become almost normal. So the 15% people reach the hospital faster. So hospitals get more brain hemorrhage patients as compared to this 85% who would rather prefer staying at home and doing some malish and all those kinds of things, and hawa lag gaya and all those kinds of things, different kind of nomenclature in different parts of the country and the world. Next slide. Yeah. So as I mentioned, this is because of blockage of the vessel. So what it says, if there is a blockage of the vessel, remove the blockage, things will be normal, common sense. Then when should you remove the blockage? It should be within 4.5 hours since the start of the symptoms. What does that mean? It means the time when the first symptom has started at home. Many times what has happened is a person goes to sleep at 11 o'clock in the night. He was found unconscious in the morning 5 o'clock. That means that you do not know when the symptoms have started. But on the contrary, if a family member has seen the onset of symptoms, I'll be mentioning those symptoms now. If those symptoms you see, rush to a hospital, by whatever means, and we call it door to needle time, right? From your door to the needle going inside your veins. that time should be ideally 3 hours. Earliest the drug is given, better results are. Delayed treatment, bad results. So the window is now 4.5 hours. It's an extended window period. I would advocate within 3 hours. Now, can you imagine one thing, that this within 3 hours is only possible in urban areas, only in bigger cities. And the burden is very high in the low socio-economic group, remote areas where even basic healthcare is not possible. In Jharkhand, at least, a tremendous change was seen in the grassroots improvement of infrastructure and good health administration when Dr. Nitin Madan Kulkarni was there as the health secretary. But even in town, patients don't reach you in time. They reach you after 4 or 5 doctors. Everybody suggesting something more, and people spend their time doing all those things, right? So this, we have to just remember that stroke is reversible if you reach hospital time, and the facilities for thrombolysis available. Now, as a common man, one should find out now itself which are the centers in your city where thrombolysis facilities available. Because when you suffer from stroke, you will waste your time finding which hospital has facilities for stroke. So thrombolysis. So remember this word thrombolysis, right? And believe me, I'll tell you my experience. I was earlier for 15 years in Apollo Hospital, Ranchi. We treated 6 patients. You know the reason? People said that hospital is 10 kilometers away. If 10 kilometers is a distance, sir, what about a city which has got an area, 100 kilometers, right? But they have many hospitals, fine. Now, the present hospital where I am working is in the town. So in 15 years, I did 6 patient thrombolysis. In last 7 years, I did about 15 patient thrombolysis. What could be the reason? One, patients rushing to you in time because you are nearer to the town. One, maybe more awareness because of internet and all those things as compared to 20 years back. But only 15 patient thrombolysis till now. Even the doctors do not know or they send in time. And even doctors have been the victims of stroke and they did not know that thrombolysis could have been given to them. They said, now coming to this brain hemorrhage, hemorrhagic stroke. In this, there is no blockage, there is rupture. The artery is ruptured. And most commonly, the high blood pressure is the cause. And then another most common is blood thinning agents. Commonly, as Dr. V said, antiplatelet agents. Common man says blood thinning agents. Clopidogrel, aspirin, dispirin, all these blood thinning agents. Now, the management depends upon the size and the location. Even a big location in a relatively normal area of the brain is no problem. But even a small blood in the most critical area of the brain stem, is very dangerous, right? So we have to reach the hospital in time, whichever, ischemic or this. Next slide, please. Yeah, these are, see, now you see there are certain risk factors which are fixed, can't be changed. Your age can't change. I mean, yes, it can change. It will become one day old daily, but you cannot decrease your age. And then males tend to have it more. I know now you can argue that males work more, they go out, they are in more. I mean, this doesn't hold good. Now females are also as kandha se kandha haath mila ke chal rahe, but something like genetic predisposition or again stress would be a factor. And then race. Certain races are more vulnerable to stroke. And in a patient who has got a previous stroke can have another stroke. So the aim of treatment in stroke is always that if you had a stroke, you do the rehab part is one, and take measures that you do not suffer from stroke again, because the risk factors for stroke, the diabetes, the hypertension, the high cholesterol is already there, and you are getting old daily one day. Family history of stroke, again, there's a stroke risk, high fibrinogen. Now, but these are fixed. You cannot change. What has happened has happened. But what can you change? The most common cause for stroke is, firstly, diabetes, hypertension, and obesity. If you have only hypertension, you can have stroke. If you have only diabetes, you can have stroke. If you have hypertension and diabetes, it cannot be plus, it will be into. it's multiplication. एक और एक दो नहीं होगा, एक और एक 11 होंगे, something like that. It is a no, and then obesity. So first these three things, and remember that diabetes, hypertension, obesity is the problem for this country at the moment. And then heart disease, atrial fibrillation, hyperlipidemia, or people say cholesterol ज़्यादा हो गया, fine. That lipids deranged, smoking and alcohol, oral contraceptives, and then any kind of coagulopathy, like they take cancer drugs and all other things, right? So these are the modifiable risk factors. These can be changed, and we have to take measures to change it. Next. Now, look at this. This is a very important slide. This says, look at the smallest one, the bar, where population of people in the population, they don't have any risk, right? But A says high blood pressure needing treatment. So the chance of having a stroke is about 15%, 10 to 15%, only because you have a high blood pressure. The brain hemorrhage part is there. Now, if you have diabetes, again the person, A plus B keeps on rising. A plus B plus C, hypertensive patient with diabetes, smoking cigarettes, again A plus B plus C. Now up to A plus B plus C, now D is atrial fibrillation. So it just keeps on going up and up and up, right? Next slide. So now the most important thing, as Dr. Kulkarni was mentioning and Mangesh was also mentioning, that what should a person do at home? Remember one word: sudden one-sided weakness, or sudden numbness in one part of the body, or sudden vision loss. I'm adding the word sudden deliberately. I'm hammering this word into the heads. Sudden diplopia. Diplopia is what? You can see double vision, right? Yeah, anything you see is seeing a single because both the eyes focus. Now you'll be seeing two different shadows. One, so there's something wrong in the vision part. Then you are not able to speak properly, altered speech. Ataxia is the word which we use for imbalance. When you walk, there's imbalance. And then vertigo, there is that chakkar, giddiness, right? So these are typical symptoms. And what can happen again with this is a patient may become unconscious, or they can have convulsions, right? So vomiting, sudden headache, vomiting, convulsions, these are the three symptoms which can take place, which can come forward in any kind of brain problem: headache, vomiting, and convulsion. But I did not write these three words in this because these words are typical symptoms of stroke, apart from or in addition to these headache, vomiting, and convulsion. Now there are atypical symptoms on the right side. These are isolated vertigo, right? A little bit of forgetfulness, a little bit of not able to speak properly, and all those kinds of things. So I would rather ask you to remember typical symptoms. Forget about the atypical, right? Next. So this slide just speaks a lot. Look at this on the left side. I just read out: headache, mental changes, confusion, not able to, one side of the body, weak. Many times why there is speaking problem and a lot of frothing coming out. In a stroke, there's difficulty in swallowing, right? So many times when a patient is admitted in the hospital and you have a CT scan problem in the CT scan, you think the doctor is going to treat. But what happens is these patients have got swallowing reflex. Patient aspirate in the hospital, and the people say, "Ki hamara patient to theek tha, why did he deteriorate?" Right? And then there's incontinence of urine, convulsions. So I'll just move from this slide. Next. Now, I just mentioned what are the warning signs of stroke: sudden confusion or not able to speak, sudden trouble walking or dizziness, severe headache, numbness. Next. Now, why people do not take treatment? Because your eyes do not see what your mind does not know, right? So if you know the symptoms, you'll be able to immediately identify. Somebody in the house will say, "Oh, this is stroke. Come on, let us rush." Speak out. Maybe it is stroke. Suspicion is the first thing from where your actions will start. To suspect a stroke, right? People do not recognize the symptoms. And then when you have some symptoms and these symptoms have come and gone away, people say, "Sam kuch to garbad hua hoga, kal subah doctor ko jaake dikhai." Something like that. So the sense of denial. Then how can I have stroke? I daily go for walk, morning walk, 5 kilometers per day. I take a lot of fresh oxygen before anybody gets it, right? So you deny that I'm healthy. I go to my doctor regularly every month. Every year I've got a heart checkup. So what? So this sense of denial has to go away. And then if somebody says that, look, it may be stroke, then the family with nothing can be done. So this is not good. Then people start worrying about the cost. Then sometimes you say symptoms will go away, let us do some malish. Then they keep on searching for the hospital because the society has, developed a tendency of fearing some hospitals or not trusting the hospitals. And well, there are reasons for this mistrust, which need to improve over a period of time. Before you suffer any problem, identify the kind of doctors or the hospitals where you need to go in case of any problem. So don't start planning when you're in emergency. Next. Now, so longer the time period that the person remains unresponsive, less likely is it that the patient will recover. And the first few days is very critical, and I would say first few hours. Next. So the time is critical. Now look at this. Look at the color of the brain. With a stroke, the time loss is brain loss. And look at this color. Look, the brain is lost. So each and every minute counts. And this World Stroke Day 2021, the focus is that you have to act early. You have to identify the problems. And every minute counts. Every minute is life. Every cell is life. Next. Next slide, please. Yeah. So as Dr. Kulkarni was mentioning, FAST, fast. You can also say think fast, act fast. But what does this mean? Fast is if somebody calls you up, कि मेरे को अच्छा नहीं लग रहा है, ऐसा हो रहा है, find out, talk to them, and then you ask. Now you have got WhatsApp video calls and FaceTime, all those things. Even the doctors can say, show me the patient, or even if a non-medical person, you can give a good guidance. The face, if one side of the face is drooping, or ask the person to smile and the face will become deviated. So this is face deviation. Number 2 is arms. Make the arms being stretched out like this and watch it. If one side gets drooping down, means one side is weak. Ask the patient to speak. Difficulty in speaking is again that speech, FAS. And this T is time. In Western countries, they dial number 911. In your country, you have 108, or 108 is just a transportation thing. If you've got an ACLS ambulance, if you've got facilities, which I already mentioned, always keep in your mind the facilities you want. The FAST is very important. And when a patient, the pre-hospital care is very important. Immediately look for blood pressure and blood glucose at home so that you can talk to a doctor. These basic things being done, rush the patient to a hospital. CT scan is very important. Immediately it should be. In my hospital, registration, all these things are done secondary. Patient enters the hospital, suspicion of stroke, directly goes to the CT room. We have even alerted, we have got a stroke code. The whole hospital is announced one stroke patient coming. There's a WhatsApp group, stroke alert. Every department is ready with their part of the contribution. Some medicine, some transport, some CT, medicine, all those. If you think that this patient is not right candidate for thrombolysis, again a D-alert stroke is being given out. D-alert. So all those people relax. So brain CT scan should be the first. Don't wait for 1 hour to get the registration done, because every minute is important. Do it parallelly. If typical symptoms of stroke are there and CT scan is normal, means the ischemia part, means the brain cells dying, they are not so much that the CT scan is picking up. Immediately go for thrombolysis if the patient has reached the hospital within 3 hours, or as I mentioned, within 4.5 hours, right? If that particular hospital does not have thrombolysis facilities, immediately rush to a place where thrombolysis facility is there. Because the first thing is people go to the nearby hospital. Chalo CT scan kara lete hain. But you waste time. Go to the best equipped hospital if you suspect stroke and you want thrombolysis to be done. And then these scans, CT scans, when they do not pick up any area of stroke seen very clearly in the CT scan, MRI is the next investigation. So if a good hospital has an MRI working 24/7, then immediately you can go for an MRI also. Now, earlier MRI used to take more than 45 hours. Now, faster sequences, they can do it fast. And there are typical sequences that are coming out in fact. Next. So, CT scan and MRI. And the CT scan not picking up, MRI will definitely pick up. And look at this slide. This says that one part of the brain on the left side is whitish on the left side picture. That is showing there's a diffusion weighted MRI, and more than 90% patients, this will be detected immediately within hours. You see this, immediately thrombolyze, give the clot busting medicine. Next slide. Yeah. So I had mentioned about ischemic strokes is 80%, and mostly it is because of the thrombosis. And hallmark is that consciousness level will not be altered so much as compared to hemorrhage part. The consciousness level will go down. Next slide, please. Yeah. So I was mentioning about clot busting medication, that is tissue plasminogen activator. Different names are there. And in big cities, you have this Mercy Retriever or Penumbra. These are clot removing devices. Like you do angioplasty for heart, the catheter goes inside the brain, catches hold of that thrombus, pulls it back, the flow is re-established, right? But all these things need to be done within the time given. And then if it is a brain hemorrhage, you have to do a clot evacuation by opening the skull and taking out the clot, or minimally invasive. I'll be just talking about I'll making people aware what is minimally invasive. Next. Yeah. So look at this, a huge clot on the left side, but elderly person, and it was not required. This person is one side paralyzed, but is going home. So not all clots in the brain require surgery, right? This is the importance of this slide. Next. Yeah, but these are small clots, very small, but there will be paralysis on the other side of the body. Even though clot is small, but paralysis is complete. These small clots do not require surgery. So the message is, if you see something in the brain, a clot, don't ask the doctor, isko nikalo, isko nikalo, isko nikalo. There's a pressure from the attendant to the doctor, isko nikalo. Clot nikalna is not the solution. Solution is to make the brain improve with the clot, without the clot, or whatever it is. Save the brain cells. Now, what is the role of surgery? The role of surgery, the next slide, it says that big clots can be taken out. Next slide, please. The big clots have to be taken out because it's causing a pressure effect in the brain. So take out the clot so that brain is not under pressure. But understand the problems of a surgeon. The surgeons have got an inclination to evacuate large clots. One of the reasons are pressure from the relatives, but science does not work under pressure. So any systematized protocols driven hospital, patients keep on questioning, do something about the clot. So my message is to the society is not all clots require surgery. However, in different parts of the country, the Japanese advocate early surgery even for small clots. The accepted view that in an elderly patient who's unconscious, right, and got big, large, deep-seated, clot, go by the suppose 91 very bad paralysis, unconscious. What is the purpose of treating? At the same time, small and superficial bleeds can be observed, not operated. Next slide, please. Yeah. So even this clot would say that the whole big clot, you can see on the right side, all that white thing is the clot and operated, and then after surgery, the whole clot is out. And left side of the brain is important because speech area is there. So anything on the left side is more disturbing. Next slide. Next slide, please. Mangesh.
Yes, sir.
Yeah.
Next slide is moving on. Yes.
Yeah, sorry. So I was talking about this minimally invasive neurosurgery. This is called stereotactic neurosurgery, where you do not need to open up the skull big, right? This is minimally invasive. And I don't know, a couple of slides. Go to the previous slide. No, previous slide. I think we have jumped a couple of slides. Anyway, keep on moving. So next. Look at this slide, right? The clot which you are seeing, that white thing, just one small hole, catheter was put inside, one medicine urokinase was given, which with thrombolysis, this clot becomes liquid and is taken out. So this is minimally invasive. You're not opening up the skull, you're not doing retraction to the brain, you're not disturbing the brain, and the brain as minimally disturbed, right? Next slide.
Sorry for the interruption, doctor. I think network from your end is a little bit slow. That's the reason you can see the slides. It will be shorted out. Just a moment. Thanks for your patience.
Yeah. No, I'll keep on talking. Right. So now the tendency for all diseases is that minimally invasive. You got badly for endoscope surgery. Endoscope surgery, minimally invasive. You keep on moving the slides. Next slide. Whenever this thing is sorted out. This gives quicker recovery. That, as I mentioned, if you need to go for surgery, you have to have a good team and all the facilities. Teamwork is important. Timing is important. Facilities are important. Sometimes you think that neurosurgery is easy, but rather you have been made to look like things are easy because of the facilities and all. Next. Yeah. So this I mentioned about, especially good for elderly people and medically unfit, the minimally invasive thing. But now even normal patients will go for this. Next slide. I think is it getting obstructed? Yeah. This is one of my very old slides. Look at this frame. This applied on the brain, and this how this stereotactic is done. Next slide. This is 20 years back. And this is next. Just go forward. This just mentioned that you need a very well-equipped operation theater. Next. Yeah. So this is the frame applied to the person's head, and a big clot you can see there. All the entire clot disappeared in 2 days. Patient recovered significantly, and he did not need to open the skull. Patient went home early. Hospital stay is less, cost is less, complications are less, no retraction to the brain, no cutting up normal tissues of the brain. So the recovery is good, better, early, and good life thereafter. Next slide. Yeah. These are the endoscopes. As mentioned, you put endoscope in the brain and take out the clot. Next. Yeah. So what is required is now immediate resuscitation, prevent complications and recurrence. 24 hours emergency evaluation should be there. And if you have a multidisciplinary approach, stroke cannot be treated by one person. It's like an army. You need to have a general, but you need to have everybody's role is there in a stroke. So you must be listening to the word stroke team. In our hospital, like we have tried to put in a place stroke team. All hospitals should have a stroke team, and you should also have stroke ambulances. Like even in Ranchi, you have the concept, like our hospital goes with a stroke ambulance, and it's available for all the hospitals. Anybody can avail the facilities of the stroke ambulance. And because the people there are emergency medical technicians, have been trained to take care of the pre-hospital transport of a stroke patient. What are things required, how to prevent if there's vomiting or if there's convulsions, all those things. So the whole idea is to have a neurological outcome and reduce the death rate in mortality and morbidity, right? So aim is better quality of life. Next slide. Yeah. So I would rather conclude by making these observations. Always suspect stroke, if any symptoms are suspicious, I mean, like any one of those, and get fully checked up. Mild stroke coming and going away does not mean that you're all right. That may be a harbinger of a stroke, warning sign. Go to a doctor, get everything checked up, right? And this heart checkup and brain checkup goes together. Next slide, previous slide. Previous slide back. Yes. So all households having elderly population, BP machine and a blood sugar, glucometer, blood sugar monitoring machine. And my message is, when you have a digital glucometer, many people say, sir, ye garbad hai, ye theek reading nahi deta hai. This is a common, people talk like this. See, every BP machine will give different reading at different, even every minute you're. So my suggestion to my patients have been that whatever glucometer, whatever you have, one is how to use it properly, right? Take 3 readings. Take 3 readings at an interval of 1 minute and then do average, right? First reading will be high, then second reading will be low, and then again it will be low. So it will take care of everything. Take 3 interval of 1 minute, and these BP recordings should be done at home, after meals, not after exercise, not after yoga, not after morning walk, not after fighting with your wife or husband. It has to be in a relaxed atmosphere, right? And then if you have some problem with these BP machines, when you go to a doctor, before entering the doctor's chamber, you use your machine to see what the reading is, so that your doctor's machine can be, you can check with that machine. Similarly goes for the blood sugar. One caution, some blood sugar machines have got some codes, and if you do not use the right code strip, you will always get an erroneous reading. And you go to the doctor with that chart, doctor believes you, but the treatment is not right. Go for those latest machines which do not have codes. So you can use any strip. Number 2, always look for the expired strips. If the strip has expired, you'll get a wrong reading. So this is very important. And now, whenever you go to a doctor, either a patient of stroke goes to a doctor, or a patient who is having lifestyle modification courses, take a chart of BP and blood sugar to a doctor. Doctor will understand it better. Otherwise, he keeps on struggling with the patient, and the patient's attendant trying to fish out for right kind of information. Next. And always go to a bigger hospital, after which has got a CT scan and ideally MRI. I'm sad many hospitals have MRI, but they do not open at night, just because it may not be cost viable or whatever it is. But I think saving one life, as Dr. Kulkarni was mentioning, each and every life, the cost is not in terms of money, right? The cost is in even the psychological cost, the mental trauma, and the burden to the indirect burden of the society is tremendous. The people who are specialists and working in the field of epidemiology and this sector, they'll tell you what is the cost or the burden of this stroke. Government should, I've been advocating this, and I hope this is taken forward. Now, people used to have thermometers at home. Every household will have a thermometer. Now the day has come when every household should have 2 more machines, BP machine and glucometer. Similarly, the multi-purpose worker, Dr. Kulkarni was mentioning about community health workers, they should not only be trained by the NGOs that how to recognize the symptoms of stroke, because unless they know about the symptoms, how will they tell the common man, right? One. And this, they talk about hemoglobin, they talk about safe pregnancy, institutional delivery, and the government monitors all kind of IMR, maternal mortality. Fine. Add these 2 machines in their jhola, in their armamentarium. They can identify the high-risk people in their villages, in their area of work, and even the government should go with a simple this kind of presentation or creatives identifying or portraying the high-risk factors in the vernacular local languages displayed at various areas. जैसे हमारे दो एक नारा था, government works in a large manner. So government should focus upon giving a BP machine and glucometer to these sahiyas or people going to home. And then lifestyle modification is an urgent requirement for all Indians. And I say this because India is sitting on the, it's a capital of diabetes and hypertension. And we have the all kinds of problems that exist on earth, developing and underdeveloped. We are struggling, emerging, and whatever it is. It is a lifestyle modification, and the best example for lifestyle modification and the biggest brand ambassador for lifestyle modification would be Dr. Nitin Madan Kulkarni, because he maintains a very good lifestyle and he inspires a lot of people. He's so very active, playing all kinds of badmintons, and so he is a, I won't call it health freak, but he's a good motivator. And I think Dr. Kulkarni would speak few words on this aspect, which is most important, lifestyle modification. I hope we all join hands together, the government and the government administrators and the NGOs, to spread awareness about stroke, the identification of symptoms, right kind of treatment at right time, and then good rehabilitation. Thank you so much.
Thank you so much, Doctor, for all your valuable insights on this very special occasion. And I hope all our participants have learned something. मेरा सभी participants से आग्रह रहेगा कि आप सबके मन में अगर इस सेशन से संबंधित कोई भी प्रश्न हो, आप हिंदी में कंफर्टेबल हो या इंग्लिश में हो, आप चैट बॉक्स में लिख सकते हैं. There is a constraint of time also, so we will take definitely 4 to 5 questions, as well as whatever questions you people are having in your mind, आप सब chat box में लिख सकते हैं और chat box के माध्यम से हम लोग प्रयास करेंगे कि आप सबके पास हम लोग उसका उत्तर पहुंचा पाएं. Doctor, in the meantime, once again, I welcome all the participants. I see few of our friends from media have joined. Thank you so much, Saurav and team who have joined from the Pioneer, as well as I see Dr. Pankaj Goyal, also one of the renowned oncologists. He's currently posted in Rajiv Gandhi Cancer Hospital, as well as one of our beloved mentors and founders. I see Bipin also joined us today from all the way from UK. So I welcome you, Bipinji, also onto this very session, and we'd love to have your 2 minutes also on this particular session. Sir, in the meantime, I had a very important question which comes from one of our participants. And the question is very important as we are catering the second largest population of the world. And once you have spoken about medical empowerment of common masses, so the major question is that how we can do this, when we can achieve this, and how the community health centers can be empowered with all the logistic support in which the stroke can be tackled out at a very crucial stage, as more than 60% of the population of our nation lives in the rural part of our country.
Mangesh, you want me to answer, or
yes, sir. I would love to have your answer also onto this, as well as Nitin sir, as he have holded the portfolio as health secretary also. So we'd love to have some insights onto this. And as Team Ki Lathi, as Team Aapki Lathi, we all have taken a pledge that not a single elderly couple will be left out of the city, and we'll try with collective efforts and collective intelligence with all of you that we should reach out each and every single elderly couple who is suffering from stroke, and we can help them.
See, Mangesh, no time frame can be given by any government setup. But what the government always keeps on doing is they keep on striving to devise ways and means to reach out all kind of populations, because as I mentioned, we have a different kind of population, different kind of so much language issue, but health being a state subject, all the state governments under the common guidance and directive from the central government, they can take this message of creating awareness to the village level. That is most important. And in town level, at least, if you are able to, suppose from my point of view, if I'm able to increase the number of thrombolysis, so every thrombolysis is almost equal to saving one life. Of course, there are complications, but even this is not happening. So first, make the intelligent people aware, right? One. And this intelligentsia are getting aware. The government doesn't have much of role, even the social media is doing wonders in the urban population. The government help is sincerely required in those areas where these kind of information is not reached. Number two, what is encouraging for me is now the present political leadership of the country is trying to bring back health into the focus, and it is evident from the increasing expenditure of the GDP being dedicated to healthcare, and all the state governments also doing something. And this COVID has brought back into focus how teamwork can deliver good results in tackling with this kind of problems where a huge mass was involved. And even like a state like Jharkhand, where a lot of resources are at constraint, you saw how good health administration could tackle so very successfully the COVID problem in Jharkhand. So I would rather not blame a socio-economic group or a state. Where there is will, there is way. We have to devise means to popularize this. One word, if we are able to take forward from today, is the thrombolysis. 85% having ischemic stroke, thrombolysis can be done. Develop those. Even the medical colleges, big medical colleges, do not have facilities for thrombolysis, right? So at least those places, if they can take up thrombolysis, I think the first step would be that. So time frame is something, it's a journey, and that's a very important. These small steps of talking out to each other and highlighting the importance of few things, I think the first step taken. But I'd like to know the views of Dr. Kulkarni also, because he has got a huge experience in channelizing meager resources for a good outcome.
See, this question is very pertinent in the sense that obviously we cannot provide all the tertiary, because normally management of the stroke is seen as a tertiary care management, and the model of healthcare of primary care, secondary care and tertiary care which we follow in our country, basically it will not be obviously logistically also feasible to have the thrombolysis facilities in all the community health centers maybe. But yes, I think now with the new medical colleges coming up, almost one per district, that is the standard set up by the government of India. And already we also are having about 7 medical colleges functioning plus 2 already in the pipeline. So in this scenario, we'll find that, as we can see, that the time duration is the critical point here. So we have to first reach that patient at the earliest to the tertiary care system. As we see that during this COVID times, we had our district hospitals all are equipped with now ICU beds and ventilator beds, which we never even thought earlier. Now that healthcare has come in focus, I think we'll have to come out with a subsystem where district hospitals can at least administer some type of treatment to these patients, so that just to give immediate relief before they are just being referred without giving any treatment or any type of therapy, rather than just putting an IV line. So I think this will take a lot of time, but by that time, awareness is the only thing. Awareness is the only key. Our right from ambulance operators, everyone has to be aware that if it is a case of stroke, he must know that these are 3 or 4 hospitals where the patient should be there. So there should not be any confusion about person getting admitted, doctors diagnosing him and then telling him that this is a stroke and I cannot do much about it, please refer to higher center. So if we can save that, all those referral times, I think still we can at least reach the person in 4 hours. Given our distances, I think 4 hours is a sufficient duration to make the person reach at least to the nearest possible medical college.
Thank you, sir. Thank you. One more question is there, but we will take this question after Binay's session. So I invite Binay onto the podium. In the meantime, सभी participants से आग्रह है, अगर आप लोगों के मन में कोई भी प्रश्न हो तो आप सब अपने प्रश्न को चैट बॉक्स में लिख सकते हैं. हम लोग कोशिश करेंगे कि हम सब ज्यादा से ज्यादा प्रश्नों के उत्तर को दे सकें आप सब लोगों तक, और अगर नहीं हो पाया, so it's our promise that we will send it across through email, through WhatsApp. And I invite Binay onto the dais. The podium is all yours. And once again, thank you to DigiMark and team for making this successful onto the platform of social media also. Binay, the podium is all yours.
Okay, am I audible?
Yes, neat and clear, ready to go.
So Mangesh, you are handing the mic to me when we are about to hit the lunch time. So I will be quick. But then thank you all for taking our time to address this webinar. Thank you so much, Dr. Kulkarni ji and Dr. Sanjay Kumar ji, for taking our time. I have noted down a couple of very powerful punch statements which you made, and I will talk about that. But then I will not go into the details because you guys have already covered that. But we are really humbled to have your presence in this very important webinar, and we are really proud to have conducted this on this World Stroke Day occasion. I have seen my mother suffering from stroke, and my personal experience gives me two teachings, which I definitely want to share with everyone. One is that, awareness and time. While time is the essence, but then I think awareness, it holds the key. And if you can have awareness as well as keep the time intact, I think we all can save a lot of ourselves from, fading away to strokes. So it is all in our hands. If we can just be aware and if we can just act at the right time, I think we jointly can defeat this deadly disease. I also believe that stroke, and I think Dr. Kulkarni ji also covered it and so beautifully explained, by Dr. Sanjay ji, was it needs a very strong, equitable advocacy and also concerted efforts from all stakeholders in the society. As I heard Dr. Sanjay ji saying it very clearly, that we all need to come together. Until unless all the hands meet together, I don't think that we would be successful in our mission to prevent strokes, to give the right support to the survivors and caregivers, and also see that the patients who suffers from stroke, they get the right treatment. That is what I had to share about stroke. Maybe I will take some opportunity to also talk about Aapki Lathi. You can see the first slide. It's our ikigai. Ikigai is basically a Japanese word. It's basically the purpose. Aapki Lathi is I call it as a personal introspection of my last 2 years of my life since I lost my mother to stroke, and that is where this entire Aapki Lathi story started. It is also coming together of very young minds and my team, and they all are in this call today. So Aapki Lathi is basically self-introspection plus this young folks coming together, believing in that very theme of elderly service, thinking about that and putting that plan into action. So that's what Aapki Lathi, our ikigai or purpose is. Every elderly should have a life of respect, dignity, and fulfillment. That is what inspires us every day to keep on working more and more towards this huge mass. Almost 20% of the Indian population, which is expected by 2030, is going to be people more than 60 years. So I believe that we all, as an inclusive society, need to come up and do our bit for this, elderly segment. Can you go to the next slide, Suman? Well, I will talk about this offerings. The idea is not to talk about what we are trying to do, but then if you can go to the next slide, Suman, maybe, I wanted to cover a few facts. Okay. I will not go and brain you all in the term of statistics as for elderly population, but then, yes, as I said, 20% of the population in next 10 years, more than 60, is itself an alarming indicator for all of us to come together and start thinking and executing that what we can try to do and what we should do to make this life much more better, much more respectful, and much more full of self-respect. We at Aapki Lathi have identified 3 guiding principles. I call it a 3E approach, which is empower, empathy, and engage. If we can just operate under these 3 guiding principles, I think we would be able to do a lot of betterment and make India a better place for elders. Basically, enhancing the social participation is what we are calling as engage. They need someone to talk. Elders need someone to talk. They need something to express. So can we engage them? Can we make them, not only we engage them, we keep them also active. Second one is your empowerment. I recall this statement which Dr. Sanjay ji made, medical empowerment of a common man. I think it's a very powerful statement. We all need to be, in a way, mini doctors to ensure that we do the first aid, first service for our elders or for anyone within our home, right? So empowerment is a very important thing. It is in our parlance, we want to bring almost 20% of this population to the mainstream economy, and we want to give them the opportunity to go and do and live a very in a healthy life, as well as a life which gives them a continuous source of income. And I will cover that in my next slide. The last one is the most powerful, guiding principle. What we have is empathy. And I personally believe that unless you keep yourself into others' shoes, you will not be able to solve the problems, what they are suffering. Elders need that empathy. And under empathy, our core philosophy has been active aging, mixed with the preventive care and a lot of stress, not only on health, but an equal stress on mental wellness as well. That is what we are calling as empathy. Can you go to the next slide, Suman? We covered it, but then there are very hard facts. We all need to be aware. As stroke is important, we all know that 75% of the population more than 60 is prone to strokes. So what are we trying to do that? It's not only strokes, but then other parameters. If you see, one of every two, more than 60, they are suffering from loneliness. 3 out of 4, every 60 plus, they are suffering from some or other form of chronic disease. In fact, one of the, not a verified data, but then 1 in every 2 elders is getting abused daily, right? So if we do not come together and get our acts, अभी यदि हम लोग साथ में एक साथ नहीं आते हैं, I think this huge population will suffer, and at the end of the day, we will not be able to build that demographic dividend. We will not be able to bring a digital economy. We will not be able to really add value to this overall India story of growth. So it's the time is to act now. Can you go to the next slide, Suman? Yes. It's a quick view. I wanted to just talk about that, empowerment, empathy, and engage. We are a technology company. We are not the SMEs who knows healthcare or any other business that much, but then we bring the technology flavor. Pandemic has proved that technology can do wonders. We are trying to include and infuse technology to the maximum level to see that how do we get our services to these elders in the most easy and convenient way. So first one is Swanirbhar, is basically our entrepreneur platform. I think we have been talking about creating entrepreneurs. I think this is the time when we need to create entrepreneurs. Swanirbhar is a platform which celebrates elders. It gives a platform to elders who are 60 plus, but having certain unique skills. It also gives them a platform to earn, to showcase their skills, and get to a sustained monthly income. We are in Apkilati calling it as Mera Hunar, Meri Amdani, Meri Pehchan. And that's what Swanirbhar stands for. It is all about celebrating elders and creating livelihoods. The next one is ActAge. Now, ActAge is a very specific healthcare vertical, what we have defined and what we have already executed. We are live in Ranchi with 2 of the services. There are many things under ActAge. As I said, ActAge is based on the core philosophy of active aging, more preventive care. And while defining the services under ActAge, which is doctor on a call, which is electronic health record, which we call as health book. And also we have opened a 24/7 elderly helpline urgency number in Ranchi, which is already active. The idea about ActAge is also to ensure 2 things. One is that to make it accessible, affordable, as well as available, and also democratize the entire elder care services in terms of availability and as well as accessibility. That is what ActAge stands for. The last one is engagement, and we are calling as Hum Tum. At the end of the day, everybody has a story, and the story is between 2 individuals. This platform, Hum Tum, is again an app, an AI-led artificially intelligence-enabled platform, which gives dedicated to elders, which gives them an opportunity to come, share everything, share their stories, talk, and also reinvent their life in a very different way. Play the second innings of their life in the best possible way. That is what Hum Tum calls for. There was a slide, Sumant, if you can go for, but anyways, I will just cover that. Many of the people, they have asked me a question that, why you chose Ranchi. And because most of the people, and thank you so much, Dr. Kulkarni and Dr. Sanjay Kumar, for guiding us thoroughly and being our mentors as well. I think there are two reasons which I personally am very much impressed about Ranchi, even though we are a Mumbai-based startup. But then I think Ranchi gives you an ideal place to ideate as well as execute your innovations. That is number one. Number two is, I think going ahead, I personally think that this is a city which can be the innovation hub for going tomorrow for the entire Eastern region. And we are more than happy to further invest in this city and also come live with whatever services we are planning to come for. So that is an attachment with Ranchi as well. So I think that's where I would kind of wind up my session. There is a very famous quote which I would like to end my note. Steve Jobs once said that 21st century is going to be defined by the intersection of biology and technology, right? And there is a new era which is going to unfold. I think Aapki Lathi, we entire team, we stand at the intersection point. We are operating at the edge, and nothing excites us than just seeing an elder smile and also, take their countless blessings, right? So that's how, I would like to kind of wind up my note, Mangesh. Any questions we can take it in the Q&A session. But yes, thank you so much for listening. I am pretty sure that you all, like me, have been enlightened by that fantastic, session carried by Dr. Nitin Kulkarni ji and Dr. Sanjay Kumar ji.
Thank you so much,
Mangesh.
Binay, for your important note. We will just straight away and go and take a couple of important questions. One question comes from Rakesh. Any first aid which we can apply immediately to the brain stroke patient before going to the hospital? So this question goes to Dr. Sanjay and to Nitin sir also, what we can do at our best at that point of time, as Dr. Sanjay have emphasized on the word called sudden. So. Sir, you are not audible.
Yeah, Mangesh?
Yes, sir. Neat and clear, ready to go.
Yeah. Yeah. So what do you want me to answer?
Rakesh have a very important question that immediately what first aid can be given to the patient.
Yeah. I just replied to him. Yeah, I just replied to him as the first aid. First, as I mentioned, to suspect, not suspecting is the first problem. So you suspect at home, immediately check the blood pressure and the blood sugar. Right? At times, sometimes, low blood sugar will present as symptoms for stroke. Right? So immediately, if the sugar is low, give them some sugar, 1 teaspoon or 1 sachet of sugar, something like that. So, and the other thing is that I suppose the BP is 200 or something, the patient may not be having frank symptoms of stroke, but early symptoms. So the moment you know that's high blood pressure, go to the hospital, right? But the typical symptoms of stroke that we discussed today, if those are present, then immediately you have to rush to the hospital before doing anything at home. At home, only thing that you can do is, if the patient is vomiting or patient is having convulsions, ensure that the patient lies on one side, so that if there is secretion from the mouth, it goes out rather than going in. If the patient is having convulsion, don't try to hold the person and stop convulsions. Nothing stops convulsions, stops on its own, or only it stops when you are in the hospital and where medicines are given to stop a prolonged convulsion. These are the only types. And then do not try to give water inside the mouth of the patient, saying that the movement. For every damn problem in medical science, sprinkling water or putting water in the mouth is not the solution, right? So these are things which should not be done. But always take BP and blood sugar. But rush. Don't waste your time calling up your friend doctor and all this. Go to hospital, get yourself ruled out. Ruling out is the key.
I hope Rakesh have got the answer.
Rahul has asked about if there's a metal tooth cap, is it possible to go for a CT scan brain? Yes, absolutely yes.
We will just take one more question, sir. We are already half an hour ahead from the designated time frame. So one question comes from Priya Thakur from all the way from Nepal. She asked a question that why does more women die from stroke than men? I don't know how far the data is correct, but she have a question that why does more women die from stroke than men? I think if Nitin sir can put some insight as well as Dr. Sanjay sir also can put some
See,
insight.
if you see the genetic predisposition, males are more susceptible to stroke. That's a fact of life. But as far as this question is concerned, one reason may be that women they are denied the treatment at the point of time. So they are just allowed
Absolutely
to die
correct.
maybe in rural areas and people just don't bother about them. While if the man who is a working bread earner, so if he has some symptoms, you tend to attend it earlier. So that may be one of the reasons that there is a perception that women are dying more, and that may be actually factually correct also. But overall, if you see the statistics, it is the male who are more susceptible.
Okay. Thank you so much. Thank you so much. Once again,
Yeah,
yes,
Mangesh,
sir. Please, sir.
I just add what Dr. Kulkarni has spoken is absolutely correct. The people, the women would wait for the men folk to come home to tend to their problem, and then the treatment starts. That is one reason. Another is that for not only for stroke, for many other reasons, they would like to arrange everything at home, ensure that everything already, then they venture out for the getting the treatment. Number two. Number three, that most of the female young group are on oral contraceptive pills or some of the other kind of hormonal problems. So even Dr. Kulkarni is right. The number of people suffering from stroke is more in men, but dying is more in women because of these reasons. And then the women also have more number of high risk factors: sedentary life, diabetes, hypertension, and even ignoring of smaller problems, which may be a risk factor. Even a dyslipidemia is a risk factor, but never got checked up. But these males, at some point of the other time, for any other reason, they get checked up and even the dyslipidemia is caught, but not for the female. Or in other words, for all practical purposes, the women folk are denied healthcare treatment in a low socioeconomic group for any other treatment, unless it's an emergency.
So one more thing I would like to add into this, as per the strata of our society and culture, still today in the ruler base, the decision capacity is lie into the hand of the in-laws. So this can be also one of the major reason where women can't take her decision onto going to a hospital or something like that. So thank you very much, doctor.
I think the only answer is
yes, sir. Please, sir.
I think the only answer is awareness, awareness, and awareness. Let people talk about it. There were many, simple people were not talking about toilets, and we had movies talking about toilets, right? And the government, the focus. Similarly, for these lifestyle diseases, let me tell you, trauma and all those things are being tackled. But this thing has to be tackled only by taking care of diabetes and hypertension, obesity. Be on the move, take care of your weight and the kind of food that we are giving to the kind of population different parts of the country. Suspicion is very important. Speak out that this could be stroke and get yourself checked up. That is most important. And all the hospitals, they should be geared up for treating stroke patients. And all the health administrators, they should ensure, Dr. Kulkarni was right, all PSCs cannot be given, but definitely the medical colleges should come up with these kind of things. So unless you talk about it, unless you demand it, you're not going to get it. And I think things will change very soon. I think we should end with a very positive note.
As Team Aapki Lathi, we assure you, doctor, that on a mission mode we are working, and down the line in 1 year you'll see the change in the city. And we all have taken a pledge with like-minded people, with collective intelligence, with all your blessings and with all your support, we are going to make it. I'll just take 2 minutes and I just invite Bipin from all the way from UK. He have also joined us. He's one of our core founder. I just tell him to I just invite him to the podium for 2 minutes, and then we will end the session. Thank you so much. Bipinji, the podium is all yours. You are not audible.
Can you hear me guys now?
Neat and clear, ready to go.
Thank you everyone, all the audience and to the eminent doctors for their time and creating the awareness through our Pilati platform. We will meet in person anyway, but just bit of last thought on the topic today is that, yes, what I have listened in the presentation today is that we tend to get symptoms wrong for the stroke, but things get worse once you go to a doctor and doctors start treating you for something else rather than the stroke. And I think that has been our personal experience, and that too in the rural villages and remote areas where doctors are not so qualified, that will make things worse. So my request on the platform is that medically and politically, if we can have something in place where the doctors give you the right treatment in the first time, because time is of essence, that will be really helpful for everyone. Thank you.
Thank you so much, Bipin. Once again, I'm thankful to all the guest speakers, to all our participants, to all our partners, to all our media friends. Thank you so much. Thank you so much, Dr. Sanjay Kumarji, for giving your time on this very special day from your esteemed busy life. Thank you so much, Nitin sir, being a mentor. You have always guided us the right way. And thank you so much to all of you. And we will see you very soon, sir. Thank you so much. Thank you. Thank you from the
Thank you
entire
so much.
team of Pilati. Thank you, sir.
Thank you, guys.
Thank you so much. Yeah.
Thank you. Namaste and Johar to all of you. Thank you.